As this year's United Nations Climate Summit enters its final scheduled day, negotiators are scrambling to arrive at a new agreement. This comes as the world health leaders are calling on governments to match their climate commitments to limit global heating in order to protect people from what they call unimaginable health consequences. This week, the Global Climate and Health Alliance presented a letter to the president of COP26 and the president of next year's COP in Egypt, signed by 46 million health workers worldwide who are part of a campaign calling for global climate action on health. These are some of the workers.
I have seen rising rates of heat exhaustion,
depression,
double the normal number of asthma exacerbations,
heart disease, heart attacks, stroke,
problems with kidneys, heart and lungs.
I've seen children die due to the air quality on our streets.
Vector-borne diseases as well as children's diseases.
And the worsening of psychiatric illnesses.
Stress and anxiety of not knowing, is this flood going to come again?
When the Category 4 typhoon made its landfall, the hospital's basement flooded.
Heat waves close to 50 degrees.
The unprecedented droughts and locust infestations.
More frequent, longer, and hotter heat waves are making my patients sicker.
I prescribe healthy air as a right for all children.
I prescribe the rich nations to make the biggest cuts in emissions.
To fund climate health adaptation projects.
To invest in reversal of the negative impacts.
To build resilience.
And tackle health and social inequalities.
And stop investing in
fossil fuels.
Climate change
is a health emergency, and it is my ethical duty to speak about it.
We have a crisis.
This comes as a delegation of mothers from Brazil, Britain, India, Nigeria, Poland, and South Africa attended COP26 to deliver their own letter to the summit's president, signed by about 500 parent groups from 44 countries, calls for limits on air pollution. One of the parents, Rosamund Kisadebra, had a daughter, Ella, who died last year from a rare form of asthma and is the first person in Britain to have air pollution officially listed as her cause of death. An installation by artist Michael Pinsky at COP26 features giant pollution pods that mimic the air quality of the future in various cities to show the link between climate change and health. For more, we go inside the COP, inside the UN Climate Summit in Glasgow, to speak to two guests. Amit Singh is with us, medical student at University of East Anglia, COP26 National Working Group Chair for Students for Global Health, and Dr. Jeni Miller is with us, Executive Director of the Global Climate and Health Alliance, co-chair of the World Health Organization Civil Society Working Group on Climate and Health. She helped present the letter at COP26 from 46 million health workers. We welcome you both to Democracy Now! Jeni Miller, let's begin with you. Talk about the connection between global heating, between the climate emergency and health.
Yeah, absolutely. Thank you, Amy. You know, climate change impacts health in so many ways. You were speaking earlier about air pollution. The drivers of climate change are the same. Burning of fossil fuels also drive the air pollution that is killing 7 million people around the world every year. The heat waves, we're seeing heat waves around the world. Just this year, 500 people died from a heat wave in Western Canada. The extreme weather events that bring flooding have displaced tens of thousands of people with floods in Southeast Asia. We're also seeing the spread of infectious diseases. We're seeing malaria and dengue and Lyme disease spreading into new regions as a result of changing humidity, changing ecosystems, changing weather patterns. So the health impacts they're growing, they're significant, they're touching every country in the world, and the most vulnerable countries are being hit the worst.
And talk about the letter that you, with a group of others, just delivered, representing tens of millions of health workers around the world.
Yeah, absolutely. So as we've seen these impacts on health increase around the world, the health community has really woken up and become very activated around this. You know, doctors and nurses are used to treating people when they come into the clinic, come into the hospital, but increasingly we're recognizing that we can't care for the patients and the communities that we serve if we don't step outside the clinic and address this driver of health impacts, which is climate change. So with this letter, organizations representing 46 million health professionals around the world came together around a letter articulating some of those health impacts that we were just talking about and really calling for the level of action that we need to see that we're not yet seeing from global leaders.
Can you talk about why going beyond 1.5 degrees Celsius, 2.7 degrees Fahrenheit, is extremely dangerous for people's health? And can you directly relate the issue of the climate emergency with the current and future pandemics and epidemics?
Yeah, absolutely. So we're now at about 1.1 to 1.2 degrees of warming over pre-industrial levels. And that we're already seeing these superstorms, heat waves, droughts, movement of infectious diseases, wildfires. That's what we're seeing at 1.1. 1.5 has been kind of identified as the limit beyond which we're really anticipating catastrophic impacts on people's health. And every 1/10 of a degree will make a huge difference in lives lost and health impacts. You know, the connection with pandemics, climate change is a threat multiplier. So when we have a pandemic and we're also facing climate change issues, the ability to respond to that pandemic is impacted by the challenges of climate change as well. And one of the places that we've seen that in this round is there were communities that were already facing drought-driven undernutrition and hunger. With the pandemic, that impacted supply chains and ability of people to move around and do what they needed to do. Those communities were kind of really pushed to the brink of famine. So that's on the impact side. I think more generally, you know, human beings are putting pressure on our natural ecosystems, and we know that there are zoonotic diseases that transfer from wild animals to humans. The more pressure we put on those ecosystems, the harder it will be to prevent the next pandemic that may occur.
I want to bring Amit Singh into this conversation, a medical student at University of East Anglia, which has an incredible climate division at the university, COP26 National Working Group Chair for Students for Global Health. Can you talk about this COP happening in the midst of this global pandemic and how it's affected attendance at the COP when it comes to issues like vaccine equity? We started our first day by interviewing a leading climate activist, not at COP26, but in Mozambique, because she couldn't make it there.
Yes, definitely. So that is a huge issue that we're facing right now. The pandemic has meant that a lot of people who are in the global south, as in countries within Africa, within Latin America, and other countries like that, they can't actually come to the UK. Firstly, due to vaccine access, as we already mentioned, but also due to things such as finances and visa applications not being accepted on time. A lot of the delegates that I actually know within COP right now got their visas approved the day before they were meant to arrive as well. So some of them are preparing last minute, getting the funds ready last minute to actually represent their countries, represent their communities, to advocate for health for their communities in particular. And the pandemic has definitely played a huge role in that. We've seen how the pandemic has also, decreased health equity in general. Disparities between communities are prevailing more and more. Countries, again, in the global south are being impacted more in the sense that not only do they not have more vaccines, the vaccines that they actually need, countries in the global north are oftentimes hoarding them as well. So there is definitely a huge disparity there.
Can you talk, Amit Singh, about when ExxonMobil and other companies claim that when you raise these issues, you're playing the health card whenever health care is discussed at the COP? What does playing the health card mean?
Playing the health card means saving lives. We are playing the health card because the health card is the most important card to play. This is the only way to discuss climate change from the health community. We have to talk about how it's going to impact people and their health. The amount of people that are going to actually die, sadly, as a result of climate change. We're looking at 250,000 preventable deaths per year. So playing the health card is the most important card that we can play, as that's the desperation that we're facing right now. And Exxon and all these other companies don't want to recognize that. They want to belittle the most important aspect of this discussion, which is about saving lives, about saving people, and making sure that people live good quality lives, not just live lives that are, disparaged and unhealthy, but lives that they actually deserve to lead as well.
Talk about medical students organizing around the world, Amit.
Yes, so medical students all around the world are actively working on climate change and health. We are seeing the impacts of climate change on our own patients already, going into clinics and seeing how patients are being impacted by air pollution, from heat stroke and so on. We're seeing that every single day. And not only is it hard to see and sad to see the resources being put to use in a situation where we could prevent these issues occurring, it's also sadly very traumatic for a lot of these medical students and doctors as well. So we're working as hard as we can all across the globe to call on health equity, to call on vaccine equity, to make sure the voices from those who are most impacted in particular are heard. Alongside that, we're focusing on making sure that there is an actual justice transition. We want to create change where our economic system is actually related to the health of our community. We want to create a well-being system, a Green New Deal which allows healthcare workers to actually play a clean role in our environment as well, making sure that we reduce actual diseases, but also working to make sure that we don't actually increase those emissions that a lot of people in the sustainable healthcare system have not actually been working on so far.
Let me go back to Jeni Miller, and if you could talk more specifically about diseases and how they relate to the climate catastrophe. For example, the World Health Organization reports over 250,000 additional people die each year, and you referred to some of this before. Malaria, diarrhea, heat stress caused by climate change. What is adaptation funding? How can this be dealt with?
Yeah, so, adaptation, so first of all, mitigation is critically important. We will not be able to adapt to climate change if we don't slow it down. Like if climate change is unabated, we won't be able to adapt enough to keep up with it. But that said, we're already seeing the impacts widely now, and currently there is not enough funding being put into adaptation, particularly funding that's been promised for years from wealthier countries to lower income countries to help them address the climate challenge. A significant proportion of that funding that has been made available has gone towards mitigation, not towards adaptation. The promised amounts have not been met, and in adaptation funding that is being leveraged, very little of it is going towards health and strengthening health systems. So we need to see significantly more funding being allocated to adaptation. We need wealthy countries to meet the promises they've made and actually bring in more funding, because these kind of most impacted countries, the lower income countries, are really struggling to keep up with the health impacts that they're seeing, as well as the impacts on their health systems themselves.
Last year,
we would really like to see stronger funding.
We spoke to Sonia Shah last year, science investigative journalist, author of Pandemic, Tracking Contagion from Cholera to Ebola and Beyond. I asked her about the connection between the climate crisis and coronavirus.
The climate crisis is resulting in tens of thousands of wild species moving into new places. It's scrambling our migration patterns. And so that's going to contribute to this broader phenomenon of people and wildlife coming into new kinds of contact. We can see with, for example, deforestation, that when you cut down the trees where bats roost, for example, they don't just go away. They come and roost in your back gardens and your farms and your yards instead. And that allows people and bats to come into new kinds of contact contact, and the microbes that live in their bodies, which don't cause them any kind of disease, can spill over into human bodies. And that's how we turn animal microbes into these epidemic and pandemic-causing pathogens.
Jeni Miller, your final comment.
You know, the outcomes for COP are still being negotiated. We want to see strong commitment to limiting warming to 1.5. We want to see strengthened funding for adaptation that's given to lower-income countries so they can have the resources they need to adapt. And we want to see follow-through on all of these commitments. It's critically important that we be taking action now.
And finally, Amit Singh, as you head back to your university and you continue your training as a doctor, can you talk about what you bring from this and your demands of this climate summit?
Yes. So firstly, I demand 1.5. Right now, the negotiations are working towards 2.4 degrees. As Jeni's already mentioned, this is just not sustainable and not healthy for our communities at all. Secondly, I demand that the countries that have broken the promise of 100 billion actually stick to that promise, increasing that promise, making sure that the countries that do not have the funding to actually act on this climate crisis can be supported. This funding must not be a loan, but it has to be a grant. It has to be something that they don't have to pay back, because this money was taken from them originally through impacts like colonialism and through capitalism as well. So when I go back to UEA, I'm going to bring this discussion to my local community as well. I'm going to talk to my university. I'm going to talk to my local doctors as well. We need to get the healthcare community together and act on this as a collective mobilization.
Well, I want to thank you both for being with us. Amit Singh, medical student at the University of East Anglia, COP26 National Working Group Chair for Students for Global Health, and Dr. Jeni Miller, Executive Director of Global Climate and Health Alliance, co-chair of the WHO, the World Health Organization, Civil Society Working Group on Climate and Health, speaking to us inside the COP.